So what about the fifth and the sixth finding of, in this case? We've got comments from Dr. Adijo that says that here there is ground glass opacity and pneumatocele, and here there is the traction bronchiectasis. Yes, that's right. However, I will tell you my 3 secret signs to differentiate the 3 types of interstitial lung disease. Okay, so let's start. Okay, so here's the secret. Okay, after knowing this secret, okay, keep it secret and don't tell anyone. Okay. Okay. So interstitial lung disease with white and gray signs, okay, means that there is no significant fibrosis. However, interstitial lung disease with white, gray, and black signs equals interstitial lung disease with significant fibrosis. Okay, so what does that mean? Let's start with white and gray sign. Okay, this is an example of interstitial lung disease with white and gray signs. What is the white signs? White signs mean reticular opacities. White signs mean reticular opacities, okay, or interstitial thickening, okay. So this is the white signs. This is the white line signs. So the first sign is white line signs, okay, and this is seen here. The second sign is gray patches sign. Gray patches sign is the ground glass opacities, as you can see here. Ground glass opacities, as you can see here. In this case, we have peripheral ground glass opacities with characteristic sparing of the subpleural area. Okay, subpleural sparing peripheral ground glass opacity. So we have here 2 signs, 2 secret signs, the white line sign and the gray patch sign. These signs together equal non-specific interstitial pneumonia, which is interstitial lung disease without significant fibrosis. Non-specific interstitial pneumonia. Okay. Next one. Next type of interstitial lung disease with significant fibrosis, we've got 3 secret signs. White line sign, gray patches sign, the same here, plus black dots sign, okay? So what does that mean? Okay, so here we've got the white line sign, okay? Where's the white line? Can you see these white lines? These are reticular opacities or interstitial thickening, okay? So we've got here the white line sign, okay? What about the gray patches sign? Yes, we have here gray patches sign. Gray patches sign, okay? Gray patches sign of ground glass opacities. Can you see the gray patches sign? Yes, this is the ground glass opacities. The third sign, that means that this interstitial lung disease shows significant fibrosis. What is it? It is the honeycombing or the black dots sign. Black dots sign means honeycombing, and it is not one row, it is in successive rows, in multiple rows. Can you see here the honeycombing is which is pneumatocele or lung cysts, small cysts in multiple rows. Okay, in multiple rows. This is the honeycombing. This is the black dot sign. Okay, so the presence of this black dot sign indicates this is interstitial lung disease with significant fibrosis. Interstitial lung disease with significant fibrosis. Okay, and this can be divided into either usual interstitial pneumonia or idiopathic pulmonary fibrosis. Okay, how to differentiate in between? So usual interstitial pneumonia is diagnosed if there is an underlying cause. However, idiopathic pulmonary fibrosis is diagnosed if there is no underlying cause, as this condition is idiopathic progressive fibrosis of the lung. However, here there is underlying cause, underlying connective tissue disease like rheumatoid arthritis, scleroderma, asbestosis, drug-induced pulmonary lung fibrosis. Okay, so here's the underlying causes that may cause usual interstitial pneumonia. And make the usual interstitial pneumonia the most likely diagnosis rather than the idiopathic pulmonary fibrosis. Okay, so here we've mentioned this case. I think we've mentioned this case. Yeah, this is the one we didn't mention. Okay, so here we have the white line secret sign of reticular opacity or interstitial thickening. Can you see the white line? Of course, there are innumerable reticular opacities here. Okay. What about the gray patches secret sign? Yes. Can you see these gray patches? Yeah, it is different from the normal lung parenchyma. This is the gray patches sign of ground glass opacities. Okay, what about the black dots sign? Yes, we have here black. Can you see the black dot sign? Black dot sign, which is seen in rows. Okay, it's not only one. Only one can be paraseptal emphysema or However, successive rows of very small cysts like this is called honeycombing appearance. What about the traction bronchiectasis? Traction bronchiectasis seen in both kinds of interstitial lung disease, can be seen in non-specific interstitial pneumonia. Okay, let's here in this case, as you can see, we can find some traction bronchiectasis. So traction bronchiectasis is non-specific finding, can be seen in both non-specific interstitial pneumonia and in the severe form of fibrosis, which can be usual interstitial pneumonia or idiopathic pulmonary fibrosis. So here, in our case is an example of usual interstitial. Our case is an example. Yes, this is our case. Is an example of usual interstitial pneumonia. Because there is a severe degree of fibrosis with honeycombing and ground glass opacities and reticular opacities. So that's all, and thank you.